All right. So just to start off, can you tell us a little bit about, kind of what leadership in neurosurgery means to you or looks like to you? Of course, there's a lot of ways to, kind of take on a leadership role, but what more generally does that look like to you both?
Dr. Lee, you want to go first?
Yeah, sure. Well, I think leadership comes in a lot of different forms and different styles. And I think in a nutshell, I think it's important that a leader is one who inspires and motivates action, and usually has sort of this can-do personality. And I think it's important that even at different various stages of your training and career, there's always a role for you in leadership, because you're involved in a specialty that is going to make a difference in people's lives. So you want to be able to lead change. You want to have a vision, and you're in a position to empower people and inspire people. So to me, I think that's what the leadership kind of means.
Yeah, I'd second what Dr. Lou said. I think one of the bigger things that I've learned during residency is, a lot of your stages from college to medical school to residency, you're sort of just, you're applying to different places. You're hoping to get a chance. You're getting to medical school. You're hoping that a medical school takes you. You're applying for residency. You're hoping that you match somewhere on the higher end of your list. And you're always sort of looking for something. And I think once you become a resident, I think one of the biggest things that I've learned is you have to understand the concept of ownership. And I think that's a very important thing, especially within neurosurgery, just showing ownership of everything that you do. And I think whether it's a small task, a big task as a resident, or going to a case, following up on a patient, I think one of the biggest concepts of being a good leader within neurosurgery is showing ownership of everything you do, and taking pride in whatever you do. And I think when you take pride and you show ownership, I think that you're, doing those two things, you're developing as a leader, and people around you will follow. So,
Yeah, that's awesome. And I know that's something that's been talked about a lot in neurosurgery and outside with things like Jocko Willink's book Extreme Ownership. Really, even if you're not directly responsible, taking responsibility as a leader. So that's awesome. Are there any particular leadership qualities or skills, or even leadership styles that you see being particularly helpful in neurosurgery, or that neurosurgeons tend to kind of take on?
Yeah, I think in terms of there's obviously different styles, and I think the style that I think is very important is you have to be a good communicator, and communication is key. Having clarity of your message, um, and I think also when you're leading, you should lead from the front and set the example. And oftentimes that takes, what Neil was alluding to is ownership, and part of taking ownership sometimes is sort of admitting that, especially when things go wrong, or things don't work out, ability that ability to sort of take the blame, as opposed to shifting or assigning blame, and say, what, that was my bad. I made that decision, and you know let's go from there. And I think that shows qualities of humility and some integrity, and these kinds of things actually gain respect of your team members.
yeah. So I totally agree with what Dr. Lou said. Now I've worked with Dr. Lou for the last 6.5, 7 years, almost 7 years as a resident, and he is very, very good at that. He's a very effective communicator, and I think that's important. I think as a resident, you look towards your attendings for guidance as to what the right things are, how to do certain things, and not just in the operating room. I think talking to patients, in conferences, academic conferences, and you have to be the one that's showing humility and leading by example. And it's very easy to communicate with doctors who's always available, always there to talk about patients. care and things like that. So I think those are very important qualities as a leader. And I think another important quality is that you bring people together. You can't be the one that divides the group. As you move forward in residency, you realize that people are looking towards you to lead by example. As chief resident, even within the hospital setting, alone, if you walk into the ICU and you're the neurosurgery resident, people are looking towards you to, provide answers and things like that. So I think it's very important to just know that, people are looking towards you to lead by example. And you always sort of have to be in that mindset, regardless of what setting you're in, especially in the hospital.
Awesome. Thank you both for that. I think I really want to hone in on this concept of ownership because, you both have talked about it and it's super important, but I think it's probably something that's intimidating, especially for, kind of type A people that are used to always doing well and being right. So do you think ownership is something that, people are kind of inherently born with, or is it something that can be developed? And if it can be developed, what ways have you kind of learned to develop that more?
It's probably a combination of both, but certainly you have to develop it. And I think it's through the little things too, your day-to-day tasks, even as a neurosurgeon. I mean, we're in a position of caring for people's lives, and in neurosurgery, you're often in life or death or a very life-altering decisions that can make or change, these patients, even whether it's even making decisions in surgery, making decisions whether or not to take a patient to surgery, and then of course all the day-to-day, minute-to-minute decisions sometimes in the perioperative care. So, it ultimately rests on you, and you have to take ownership of that. But at the same time, you also have to rely on other people, and that's where teamwork comes in. And we often rely on other members of our own team, but also other members of other specialty teams. But ultimately, it rests on you. So even something goes wrong, and it maybe wasn't a decision that you made, but it's something that you relied on another team, you can't help but take ownership of that. And I think, as neurosurgeons, we ourselves often take the blame on ourselves, but also I think the general public does too. I mean, when a patient comes to have surgery with you and you're involved in a team surgery that includes other specialties, guess who the patient always calls for their problems? It's the neurosurgeon. So I think, we're sort of thrown into that role when we choose this specialty, and you sort of learn sort of how to do it, and sometimes in a sink or swim kind of situation.
The weight of the scrub cap, right?
What's that?
It's sort of the weight of the scrub cap, right? Like the weight of the badge kind of phenomena. Yeah. Awesome.
Yeah, I guess I can answer your question more from the resident standpoint. I think it can be developed. I think it starts, as an intern. Again, you talked about, we all talked about ownership, and I think that concept is important. As whether you're following up on labs as an intern, going to examine patients overnight, providing a good sign out in the morning, and I think if you show that you are, capable of understanding all the little things, I think those. It's about talking about books again. There's a book called Atomic Habits, and they talk about all the little things that you have to do in order to form a habit and keep it going. And so I think you develop as a leader through residency because people automatically look towards you to provide answers, and it's asked of you by your senior residents, by your faculty members, to go be on top of all the little things. And as you develop those skills through your junior residency, it becomes automatic as you become, a mid-level resident. And as a chief resident, that's where you're supposed to show that you've honed all these skills, that you are understanding of the total, of the whole concept of taking care of the patient. And it becomes like, it becomes a habit. And I think automatically you develop as a leader if you follow that path. If you are on top of all the little things as an intern, you're following up on things, as you develop those skills as a mid-level resident, and you go forward as a chief. And I think it's important to understand that people are always watching you. People are always looking for towards your example. And it's the same thing that Dr. Liu alluded to in the operating room, where you're working in a team surgery or a team setting, whether you're working with anesthesiologists, you're working with ENT, you're working with general surgery. Everybody still, even at the resident level, is looking towards you for answers. And I think one of the important other things is it's okay to say you don't know, and that's okay. You don't always have to have the answer, and it's important to rely on your colleagues for answers too.
Awesome. I kind of want to cut to one of the questions I had for later, but you both mentioned the importance of relying on teams and developing these kind of high quality and probably high efficiency teams. So how do you go about doing that? For Neil as a resident, developing your resident team into a high quality and high functioning team, and then for Dr. Liu, really where the buck is kind of stopping with you in terms of patient care.
I guess I can answer the resident team. You mean as a group of residents? How do you form an effective structure within your resident?
Yeah, exactly.
I think it's important to assign roles from the beginning. In neurosurgery, at least at our place, it's pretty straightforward. The junior knows their role, the mid-level resident kind of knows their role, senior resident knows their role. And I think it's important you don't have to be a jerk about things when things are missed. It's very easy to sort of get angry and upset and sort of yell at someone. And I think it's more effective that you sit down with someone when they make a mistake and tell them and ask them, why this mistake was made or why they did something a certain way, and understand why they did it, and then correct it. So the most important thing is, I think, assigning roles and knowing what your role is as whatever part of the team you are. It's kind of like when they talk about running a code, right? When the team leader has to assign who's doing chest compressions, who's logging, who's taking care of the meds, who's logging the events, and who's starting the defibrillator. So same kind of concept is you have to know what your role is within the team. And I think you have to bring people together. You can't be the person that's the leader that divides people or pits people against one another. If somebody makes a mistake, the goal is not to sort of ridicule them in front of their colleagues. The goal is to, how can I rectify this mistake, and how can I prevent it from happening in the future? And I think you have to be a person that's positive. I think when somebody does a good job, I think it's important to recognize that in front of the group. If a junior resident catches some error that that could have been catastrophic, and they do a good job, or they prevent that error from occurring, I think it's important to give them positive feedback. And I think that goes a long way, and much longer than saying something negative to them. And those are the important things. Is I think identifying things that are positive and giving positive feedback, and rectifying mistakes without making the person feel ashamed.
Yeah, Neil, I think those are really great points. I mean, especially the part about, making mistakes and always using that opportunity as education, because, as opposed to shaming. And, like you said, going back to analyze things, and, you never know, like someone could be going through something personal and you may not know. And so you should always try to put yourself in the other person's shoes. And, but maybe it's always an opportunity for education, and I think that makes them better. I also like the sports analogy, in terms of, you look at good team leaders on sports teams, and they always look at people who are able to make the people around them better at their game than they currently are. And I think that's something that we have to strive to be as well. How can we make the people around us better? Whether it's empowering them, encouraging them, assigning, roles and tasks, or identifying things that may be their strengths, and highlighting those things, and to make the overall advancement of the team more effective. And so I think that's a very important aspect in dealing, in trying to making the people that are surrounding you achieve their highest potential.
Great. Those were two awesome answers. So maybe extending out a little bit on this team question, what does it look like, working with, you said, other teams, other specialties, but also with other providers, either, mid-level practitioners or the nursing staff, physical therapy. How do you, generate that team mentality more widely beyond, just the residents?
Yeah, I think it's important to sort of be nice to everybody in the hospital. That's number one thing. You can't be, a jerk to the people that are directly taking care of the patients. I think from nurses to even, the staff that sort of changes the bedding and things like that. I think it's important to have good relationships with everybody in the hospital. We train at University Hospital, which is, state hospital, state funded, lower resources. And, I'll give you an example. It's extremely difficult to get an MRI on a patient the day after surgery because they have one MRI machine and very difficult. And how does a neurosurgery resident get 3 MRIs done in a place that, they're backed up already? They have outpatient MRIs, they have inpatient MRIs. And I think, you just have to have a good relationship with these people. And you can't call them and yell at them and say, hey, I have 3 MRIs, your day, as a junior resident, you're running around, consult, take care of sick patients. The last thing you want to do is have to deal with these MRIs getting done. And, how do you get them done? You have to be nice to these people. You have to be reasonable. You say, hey, these are post-op patients. And, what can I do to make these get done? Do I have to get the patient myself? Things like that. So I think it's important to have good relationships with the people that are directly taking care of patients. And I think it's important to not just say to them that they're valuable, but feel, understand what value they bring to the team. For example, if you do a spine surgery, a lot of times patients have to go to rehab, and the physical therapist, you rely on the physical therapist to provide their assessment, teach the patient, how to get out of bed, how to go to the bathroom, how to do all these things, and you need their assessment to figure out where they're going to go, right? Whether they're going to go to acute rehab, subacute rehab, whether they're going to go home, and they provide that you need them to figure out where they're going to go and tell the insurance company that this patient needs this or that. So you have to not just be nice to them and tell them that they're valuable, but you have to understand what value they bring to the team, and you have to make them feel valued. I think it's important as a leader to bring people together, but also tell them how they bring value to the team. So I think that's one of the more important concepts is be nice to everybody in the hospital and recognize that their role is important to the whole, patient care.
No, that's a fabulous explanation and answer, Neil. I mean, words are so important and so influential. I think it's very important just to remember. You could you could do this as a personal exercise, right? You can think about, well, what did someone say along the way that really inspired me and sort of helped me get to where I am today. Obviously none of us are here at our career based on our own doing and effort. There's always someone along the way that helped us or inspired us or mentored us, and I think mentorship is key as well. And part of being a mentee, why do we choose our mentors? Because we chose somebody who empowered us, we chose somebody who inspired us, and maybe they said something that made us feel valued. And I think that's, at the end of the day, as human beings, I think that's what we want to feel. We want to feel that we have meaning in life. We want to feel that we have value and we bring value. That's like, it's an existential answer to that, but that's kind of how it is, right? So when you are in a position and you can empower somebody, you can tell them, hey, you did a great job, or you did really nice work on that part of the surgery. It's you're really progressing nicely. Or sometimes as an attending, residents often will make suggestions that you don't think about, and sometimes they can save the patient's life, and you should really acknowledge that and really let them know that, hey, you made a difference here. you made a great suggestion that I think really changed the course of this, patient's path. So I think that's very important. I think the other thing, I think we were talking about teams. I just wanted to add, like, it's very important to have like-minded vision, and to set that vision and have clear goals. But also sometimes you can come into situations where there's obviously differences or disagreement, and I think it's also important to have some flexibility. So if you're always rigid and you're always thinking in my way or the highway, sometimes that doesn't always fly, and sometimes you have to have an open mind, and you have to be able to listen. So being a good listener is very important. Sometimes you want to listen to the other people's point of view, and sometimes you have to make compromise. Sometimes you have to say, well, maybe we don't have to do it my way. Why don't we find a compromise? Or why don't I take a step back? I won't, do this, but let's do this and proceed with yours, and then come up with some kind of a win-win situation. I think that's it's kind of the part of the art of negotiation as well. You have to concede, sometimes some of your own personal interests for maybe the betterment of the team, and finding a compromise for a win-win situation.
Yeah, both incredible answers. I love the concept of making others feel valued, and like you said, not just telling somebody that they're valuable, but really making the effort to show it. So we have a question from an attendee here that I think is sort of a nice segue into trainee leadership. So what are some effective ways that someone can demonstrate leadership in a sub-I rotation? They say even in labs, but I think we should really focus on that, showing leadership as a sub-I, because I imagine that's probably a pretty difficult kind of, road to walk and balance, being in your vertical, position in the leadership kind of role, but also showing that you can be a leader as a aspiring neurosurgeon.
Feels weird, even just, I guess I'm 7 years out from being a sub-I. It's a tough role, because I think, you're always, as a sub-I, you're trying to figure out, what do I need? You're figuring out what your role is, right? It's very unclear, and it's different at different places. Some places will just want you to show up to surgery as a sub-I and observe and, ask questions here and there, but they don't ask anything of you in terms of patient care or following up on things. And other programs you go to, they'll expect you to function as an intern, right? They'll expect you to follow up on patient care. So I think the first few days there, I think it's okay to ask one of the junior residents or one of the other residents that are there, what are my roles, in a nice way. You don't go and ask, what do I need to do here to do well? But, you sort of ask in a nice way, or you figure it out your first few days. I think it's important to, when you get to a place, to understand what is asked of you as a sub-I. And then I think it's also okay to go in and assume that you're going to be treated, you're going to be expected to function at the level of an intern. So that means whatever cases you scrub, you have to follow up on, those patients, their hospital course, see them, early on. And I think that question, I think the easiest way to answer it is just, what do you think they're looking for in their residents? What do you see the other residents doing, and how can I act as if, how can I follow their path? I think it's a very difficult role as a sub-I, and I don't, I'm glad I don't have to do it again, and I don't, I can sympathize with those that are going through it now. It's difficult. It's a difficult role, but I think the easiest thing to tell yourself is, what do I think that the program is looking for, and how can I show that?
Yeah, you reminded me of being a sub-I 1 years ago or something, 22 years ago. It's a nerve-wracking time. I mean, it's a thrilling time, because you're trying to learn. You're like putting your mouth under a waterfall, trying to absorb as much knowledge and be inspired by these neurosurgical luminaries that are in these departments you're doing the sub-I at, and at the same time, it's terrifying, because you're like, always afraid of being judged, right? You're like, do they like me? Am I fitting in? This is like day 3 of 30. It's like I got to go through 27 days of this 24-hour job interview. You know, if I say the wrong thing, or they see me, standing the wrong way for a split second, that's it. There goes my sub-I. Um, I think all in all, you can apply some of the same principles that we do as like an attending or practicing physician. You may have heard of the 3 A's. How do you build a practice? And we often talk about the 3 A's, which is availability, affability, and ability. And when building a practice, sometimes ability isn't always the most important. People refer patients to you more because of the first two, but certainly if you don't have the ability and you have bad outcomes, obviously you're not going to get patients. But, having those qualities, I think are important even as a sub-I, right? You want to make yourself available. So and that allows you to be visible. So, always having, an attitude of how can I help? What can the team need? Do you need me to push the patient down to CT scan, or let me go check that lab for you? Or, oftentimes the junior resident is like overwhelmed with like tasks, and maybe you lending a helping hand or even just asking to, shows that you're available and that you want to help. And people often, see that quality, and residents will pick up on that. And what happens is resident feedback to the attendings who are on the selection committee, goes a long way. So I think that's important. Obviously affability. You want to be likable. You don't want to be a jerk. You may have the most fund of knowledge, and it's always good to show that off. And that's always a fine line. You don't want to undersell yourself. You want to, if you're a smart guy, you want to make that known. But it's sort of a fine line where you don't want to appear that you're trying to throw someone under the bus, or outshines your peers, but at the same time there's sort of a fine line and an art to exhibiting that quality of you, and then of course ability. And so at your level of the game, it's not like can you take out this brain tumor, but the little things, can you close the wound, or can you have good fund of knowledge, and so forth. So I think those are the things I would probably focus on as a sub-I.
Great, and definitely a great question. Getting into this idea of training leadership. So let's say the sub internship goes well, and then you end up matching, and now you're an intern or a junior resident. What does leadership look like during the junior years? Of course, there is a certain role to being a follower, I'm sure, but I imagine you have to display some elements of leadership during that time.
Yeah, I guess I'm definitely closer to it than Dr. Lou, being a junior resident. I think, again, it just comes down to taking care of all the little things. Does this person, how are you a good junior resident, basically? I think the leadership stuff will follow if you're a good resident. I think that's part of being a good resident. But how are you a good junior resident? I think it's just taking care of the little things and understanding your role. Your attendings don't expect you to, like Dr. Lou said, at that stage, be able to take out a brain tumor or clip an aneurysm or split the sylvian fissure. They expect you to be able to understand what the pathology is that you're treating, understand why the patient's in the room, understand, maybe closing the incision. But it's the most important thing is, are you taking good care of the patients? And are you following up on the little tasks that are expected of you? And I think if you do those things, you show up each day to work with a good attitude. And, I used to tell myself that sometimes in the beginning of junior residency, by your third year, your second year, end of your second year or your third year, you're tired of taking call. You kind of, you have it. It's like, it becomes a little monotonous, right? You show up in the morning, you see consults, follow up on labs, you sign out the next day. You go home, you come back, you're on call again, and so on and so forth. And you get tired of it, and you're sort of looking for the next step to progress to. But I remember I used to tell myself, what, if I'm going to be holding the pager all day, I'm going to be the best damn pager holder there is in this hospital. So I think you have to sort of have this attitude where you're going to be the best, whatever role you're put into, you're going to be the best one there is in that, and you're going to do a great job, and your time will come. And I think understanding that there is a light at the end of the tunnel, to not get frustrated in the day-to-day things, that just be good at what you're doing, whatever is asked of you that day, do the best that you can, and your time will come. And I think for a junior resident, I think those are the important things, understanding that there is a light at the end of the tunnel, that you will get to clip that aneurysm, you will get to develop the skills to take out that brain tumor. But now what's asked of you is doing the little things, and you're going to do them. So at least that's what it was for me.
Yeah, these are interesting questions. They're making me dig into my dig into my memory as a resident. I think another important quality is even as a junior resident level is sort of that taking that initiative and having that ability to sort of make a personal sacrifice. So, for example, call schedule, right? Even as a junior resident, you can say, there's someone, got sick, take the initiative, say, I'll take that call, or, I'll present that case for M&M, or I'll write that paper, or I'll take on that research project, or, I'll take that patient to CT scan. And it's interesting. I there was a period of time where nobody helped you as a junior resident. It was a very, very top heavy stage in one of my training, and you never got help. And then there was a period of in my training where there was a change in culture, where a senior resident would see the junior resident like struggling to get everything done, and they would like help out and say, hey, let me hold the pager for you, or you go to the OR, you haven't gone to the OR in a while, we need to do that for you. And it's interesting how little acts of kindness like that changes the culture of a residency program, as opposed to let's torture the youngest guy in the totem pole. And it really creates a culture change, where if you're given some kind of if you've shown some kind of act of kindness, it's amazing how when you become a more senior person, you demonstrate the same. Whereas you're in a program where you feel abused all the time. It's interesting how abuse begets abuse. So I think willing to make that sacrifice is sort of the point I'm trying to make here.
Great, thank you. So kind of same question, but now for the senior and chief years, and I want to focus a little bit in on how that leadership in those years is culminated. Is it informally, or are there more formal opportunities to kind of be trained as a leader?
Yeah, I guess I'm still going through the process of my last year, so I'll let Dr. Lou sort of go first about what qualities, whatever his chief year was like. I think.
Yeah, I think as you go through residency and you eventually become, that glory year of being a chief resident, it's interesting. It's something that I think as residents we aspire to. We look forward to that year of being the chief resident, and because it's the year that it's the culmination where you take all your knowledge, your technical skills, and you're putting it up. You're trying to get that last year to get your education before you go out to the real world to be the best neurosurgeon you can be. But at the same time, you're naturally put in this leadership role because you're in charge of the resident team. You are the representative and advocate, intercessor between the resident team to the attending staff, and everyone looks to you in the hospital. Whether it's the nursing staff, the ancillary staff. They look to you as the go-to person, and you represent the specialty. And there's really, to my knowledge, I'm not aware of any formal program that helps you with that. It's a lot of it is the internal culture of your program, but you can start to develop all those qualities. A lot of the stuff that Neil was mentioning about how you treat people around you, how you gain respect, how you take ownership, and maybe there are formal programs I'm not aware about, but but maybe there should be. Maybe Neil can highlight maybe some existing programs that you've had.
Yeah, no, I don't. At least for our residency, I don't think we had any existing programs. But I think one of the more important things that Dr. Lou said that I'm learning about as I go through my chief year is that concept of making people better around you, people around you better. And I think that that's something that I've sort of learned over the last year or so. How can I? And I've asked myself, how can I do that? And I think it's again what Dr. Lou said about being setting the example. You know, if the junior resident's struggling, you know, for example, on weekends we have home call, which can get becomes in-house call really quickly for the whole weekend for the junior. And how can you as a senior help sort of make that a little bit easier? Is it writing notes, helping them see a consult? And the whole overall goal is how can I make them better at neurosurgery, and how can I make them a better leader? And that's what I'm sort of learning how to do as I go through this year. And then the other thing that I think is important is what Dr. Lou said, is being an effective communicator, because you are the person that, taking all the information that the junior gives you about the patients, their labs, any exam changes that happen over the 24 hours. Then you're going to see those patients quickly. You round over an hour on maybe sometimes 30, 35 patients. And then you're taking all that information, packaging it up, and giving that to the attending, and devising your own plan. So you have to be an effective communicator in the way that you process information, package it up, tell your attending about it. And then your attending will explain something to you about why they're making a certain clinical decision the way they are. And then you're relaying that to the team. And in the past, as a resident that you take call on the weekend as a senior level resident, I would just provide the plans. Okay, Dr. Lou wants this, and this to be done for the patients. Just get it done. And now I'm thinking, as you become a leader and you become in the chief role, you're trying to make the people around you better. And now I'm explaining, Dr. Lou wants to do this because of this, and this reason. And, I think that's easier than for the junior resident to do a task, if they understand why something is being asked of them. So I think, making the people around you better and being an effective communicator are two things that I'm learning as I go through this year. And how can I do those things better?
Great, thank you both for that. So going off of some of this, formal training. So, I think we've seen people who, as they start, stepping into more administrative roles, or, chairs, pursue, kind of an advanced leadership training in an MBA or in the CNS Leadership Institute. What do you think the value of those kind of pursuits are? And do you think that maybe that should be included at earlier stages of neurosurgical training?
Yeah, I think it would be interesting and probably important to formalize, some of this. I was fortunate to attend the CNS Leadership Institute earlier this spring, and it was a great workshop. I got to network with a lot of people at my level of career, and really talk about a lot of the concepts and theoretical stuff, but also practical. We were given tasks to develop some kind of project within our own programs, to help develop certain areas, whether it's finances, developing some kind of financial compensation model in your program, or develop some kind of clinical program or quality quality safety measures in your program, or if you were primarily a physician scientist, what kind of programs you can develop within your research program. So I think having some formalized training and workshops is very important, and we probably should have it earlier in our training program, and even early to mid-career programs as well.
Yeah, I think I would have welcomed it during my training as well. I think getting, whether you get an MBA or like master's in public health or whatever it is, I think it's those things depend on what your goal is, to what you want to get out of your career. Some people will just want to just go into practice and take care of patients and have that. But if you want to develop to the point where you are, running the neurosurgical service line in your hospital, you're the chief of neurosurgery of your hospital or hospital system, I think, the understanding, whether it's an MBA or whatever degree it is, or even just some course that you take, I think understanding the role and your value as a neurosurgeon and the value of your department and the whole in the hospital setting as a whole, I think those courses those degrees would help with that. And I think in retrospect, I probably would have welcomed that aspect of training, aspect of education in my training. But I think it's important. But I think it all depends on what you end up wanting to do and how you're going to use that additional knowledge that you have.
Great, thank you. I want to open up the floor to any questions that any attendees have. So I know we took one attendee question so far, but for people in the audience, feel free to raise your hand and I can let you unmute, or send a question in the chat or the Q&A. And while we kind of wait for those to come in, so I think we hit on this a little bit without actually using the word, but how do you view yourselves as, sort of a coach in the leadership model? Like Neil said, inspiring others to, be their best selves.
Why don't you go ahead, Neil?
Yeah. So I guess, how would I view myself as a coach? That's the question. I guess it's important to understand what the role of a coach is, right? A coach, there's different types of coaches. If you take the best coaches from sports, you can look at Phil Jackson, you can look at Belichick. How are those people successful in their roles? And I think it goes back to what Dr. Lou said: is how do you elevate the game of the people around you, or the people of the group that you're leading? And I think I'm personally trying to understand that every day as I go through this year and as I've gone through residency. How can I be not only good at what I'm doing? How can I, because I myself am still learning, right? Even though you say you're chief resident, you have to know this, and this. I myself am still learning, in the operating room, learning in patient care. And I think it's just by leading by example. The thing that I've sort of, the thing that helps me the most is I tell myself that I have to be the hardest working person in the room, coming in on time in the morning and the last person to leave and trying to scrub every case. And I think the most important thing that you can do is, if you're not born a natural leader, is I think you have to just put yourself in the position where you can lead, right? Is just be available all the time. So I think being a good coach is somebody who leads by example. You can't be the guy that sits on the sideline and tells somebody to run, 40 laps, 50 laps around the football field while you're munching on a donut on the side, right? Then you're not going to get any respect. I think you have to be the person that shows up on time and leads by example. And I think that's what I'm learning as I go through this year. Just be available for the people around you and provide good feedback to them. I think that's important.
Yeah, I think we touched on a lot of the things before, about words of encouragement and acts of kindness, and having a vision as well. And I like Neil's references to guys like Phil Jackson, and Belichick, these winning coaches. And I would also add in, I don't know if you've seen the show Ted Lasso. If you haven't seen it yet, it's a great show. But Ted Lasso is a lot of businesses look at the example of Ted Lasso and his leadership style. He's one of exemplifies empathy and personal relationships. And so he'll see a player who is struggling and really hones in on what's the issue with that individual, and he's sort of able to sort of click on a switch that makes that player see something different and helps attain their best potential. And I think sometimes that's what we have to do. It's not just commanding this or that, but sometimes it's personal relationships and figuring out what it is this person's strength is and how can they contribute to the team in a significant way. And if you can do that and turn that switch on to that person, it's you can achieve amazing things for that individual, but also for the team overall.
Great, thank you. Any questions from the audience? Well, maybe one to wrap it up on. So what kind of opportunities exist for medical students or residents, or even Dr. Luz, you were talking about with the Leadership Institute for, later on in your career to build your leadership skills, whether informal or formal?
I guess I can answer for medical students and residents. I think it's just, looking at identifying a mentor. I think that's what Dr. Lewis said early on, is just I try to identify people around you that are, good at what they do, that whose example you want to follow. And I think that's one of the most important things, is identifying people early on, whether they're residents, whether they're attendings within the field that you want to go into. Mostly everybody here probably wants to go into neurosurgery, but even if you don't end up choosing neurosurgery, identify one or a couple of people whose example you want to follow and see the things that they're doing. I think that's one of the most important things you can do early on, is develop a relationship with a mentor and have them guide you. I don't think there's obviously, like, you can go to a how to be a good leader camp, or you can watch some YouTube videos on how to be an effective leader and those things. But I think really seeing somebody act that out within the specialty you want to go into is a lot more effective. And then developing a relationship with them as you go forward. And I think that's one of the responsibilities of your mentor, is to help you as a mentee develop your skills, not only just as a leader, but how to be a better student or a better resident, and all of that. So I think that's very important.
Yeah, just to add to what Neil said about mentorship. Mentorship's so critical. I just feel like I've had not just one mentor, but many mentors along the way, and you continue to develop new mentors, even in your mid-career. What I want to also point out is mentors aren't always just the people that are in your own institution. You can develop relationships with mentors outside of your institution, and like I said, there's a lot of people around that are not even within my own department that I look to as mentors that have really helped me along the way, and that's just through networking. Just attending society events and national meetings and serving on committees. So get involved. There's different ways of getting involved in committees at different levels. There's the intra-departmental level, so within your own department you can have various committees, like a finance committee or education committee, or residency selection committee, and then there's hospital committees as well. Looking at new technologies or quality assurance, things like that. And then on the national level, in your professional societies, there's a lot of opportunities for committee work, and it's just a matter of you stepping in and say, "Hey, I want to help," and there's plenty of things, and that's a great way to create a network, and it's these networks that really help help yourself and colleagues. You create a community where you're helping each other, you're exchanging ideas, you're sort of sharing your journey together, at the same step of the career.
Great, thank you. So I'm not seeing any audience questions. So I wrote down, a couple of key things that stuck out as we went through. So maybe I'll just summarize those. And then if you want to add on, any just last pearls. So we talked about the idea of ownership quite a bit, communicating clearly, making others feel valued, with an emphasis on making them feel valued, not just telling them that, being a good listener. I like Dr. Lou's, 3 A's, the availability, affability, and ability. The role of acts of kindness to inspire culture change, and then just inspiring, kind of as a coach, the others around you. Any last pearls that you guys would want to add?
I think that those are all important things, and the most important thing is just be yourself. You don't want to be a fraud as a leader. You want to stick to your core values and be yourself. That's important.
Yeah, I echo those same things. Yeah, be yourself, and be true to yourself, and hopefully you develop good core values early on, and exhibit those qualities along the way.
Well, thank you both so much for taking time out of your Saturday morning to join us. And
hey everyone, Ryan Rad here from neurosurgerytraining.org. If you like that video, subscribe and donate to keep our content available for medical students across the world.